support. With up to 10 hours of training per day, health problems happen frequently. And unfortunately, most of these happen during the season where a quick turnaround was necessary. This led to many athletes, including myself, relying on synthetic solutions that could potentially negatively influence the body in the long run. This isn't only a concern for athletes, however. People all over the world deal with discomfort and are looking for natural ways to support their bodies. Today, we're going to talk all about relief and how you can find it using the natural solutions at your fingertips. We've brought in some of the best experts on this topic, from doctors to athletes to scientists. We will pull from their insight, ask hard questions, and get to the heart of how you can find relief using natural products. We know that this is a topic so close to many hearts, and to help us all connect today, we want to hear from you throughout the session. Post where you're joining us from with the hashtag doTerra Pursue 2020. We have 25 relief kits ready to give away to 25 lucky people who post where they're watching the session from today, so do not miss your chance. Our first presenter is Dr. Paul Wintherton, a board-certified orthopedic surgeon with decades of medical experience.
It's my distinct honor and privilege to be involved with this year's festivities, particularly with regard to presenting ideas promoting physical comfort, the physiology of what causes body discomfort, and discuss some of the developments in how the medical field is addressing these matters. When we think about discomfort, we can think of it in terms of short-term or persistent. An example of short-term discomfort is when you hit your thumb with a hammer. This hurts intensely at first and then slowly fades over time. Let's walk through what happens in your body after you hit your thumb with a hammer. Unpleasant physical sensations involve receptors, two-way communication between peripheral nerves and the central nervous system, and a variety of chemicals along with that. When a traumatic or non-traumatic injury occurs in an extremity or deep within an organ system, copious amounts of a neurochemical called serotonin and the electrolyte potassium are released at the site of injury. Serotonin can amplify or calm the signals being sent, and potassium is involved in the firing of our neurons. Specialized receptors are found within layers of skin and deep tissues like muscle, joints, and most of our visceral organs that serve to detect sensations, such as heat, pressure, tingles, and of course, discomfort. The different types of stimuli are received by these receptors, and if the stimulus is strong enough, it's changed into electrochemical signals that are sent to the central nervous system. The spinal cord begins processing that signal sent from the peripheral nerves and releases excitatory neurotransmitters, like glutamate. The brain receives the signal and determines the quality, location, and intensity of the stimuli, triggering feelings of discomfort. However, if this assault to the body, in this case your thumb, is not corrected and resolved properly, healthy nerve function can be disrupted, making the soreness become more intense and persistent. In this case, serotonin is released by the brain into the spinal cord, which activates channels in the peripheral nervous system that become hyperactive. This serotonin release at the site of injury, as well as the release of serotonin in the brain, is a very important factor in how we perceive potentially damaging stimuli. Specifically, serotonin creates varying levels of tolerance to the unpleasant sensation, whether it be traditional injury-associated discomfort or the kind of emotional discomfort spawned from despair or depression. With an agitated nervous system, unpleasant sensations are amplified, and other nerve cells respond in a cascading, negative manner. Inflammation is another trigger in this cycle. Inflammation is your body's normal response to infection or injury. It's a protective mechanism that stops damage to tissues and cells. But if it persists longer than it should after an injury or infection, it can cause pressure to build in the affected area that irritates sensitive nerve endings. This can disrupt proper nerve function and make them more sensitive to noxious stimuli. The goal is to better manage this cycle, from stimulus detection to response and resolution. We can intervene at different points in this cycle to support healthy resolution before it becomes persistent. For the past few decades, the medical field's approach to addressing this cycle has resulted in some problems. The overall reliance on synthetic chemicals to intervene in this cycle of discomfort has not been entirely effective, to say the least. The combination of factors such as emotional, mental, and social components also contribute to persistent discomfort. The way we respond to unpleasant stimuli can either make the sensations worse or better. These important factors are not being addressed by an approach that relies excessively on synthetic chemicals. We're realizing the impact of that approach and are aggressively moving away from it. We're actively looking for better solutions, and that's why we're here. So what is our solution? What will be our new direction and trajectory to help people find relief? One such solution is essential oils, which can help with the physical, emotional, mental, and social aspects that contribute to this cycle of discomfort. There are many supportive essential oils to help with occasional minor aches and more persistent unpleasant sensations, including ways that essential oils can augment other solutions we're using. We're currently moving toward promoting the philosophy of self-efficacy, or in other words, fostering the confidence in oneself and our intrinsic natural capacity to manage this discomfort cycle. This self-efficacy has been unequivocally proven existent, strong, and effective within the psyche of our patients, creating resilience that produces the ability to recover from setbacks and or adapt in stressful, uncomfortable situations. Towards this end, education is the key to unleash these cognitive powers our patients have. Yes, we can train them in their ability to acknowledge, characterize, and qualify the unpleasant sensations they feel. We can teach them about fear management with the promise and understanding that their discomfort will evolve and improve if they engage it in emotionally healthy ways. This is the core principle of self-efficacy. In fact, this is the philosophy and solution trajectory espoused by my beloved American Academy of Orthopedic Surgery. Most recently, in 2017, the value of integrative, supportive use of essential oils was strongly promoted by the American Academy of Orthopedic Surgery in a paper published in the Journal of Bone and Joint Surgery, the greatest medical journal of all time. Specific protocols used as complementary solutions were formally endorsed as standard of care. Isn't that remarkable? Isn't that fabulous? For years, we've enjoyed protocols designed to provide relief that are pillars of Western allopathic medicine. Now, included within these FDA-approved pillars exist supportive, complementary modalities promoted by our most revered medical societies worldwide. Isn't that spectacular and exciting? Any other medical society or vertically integrated healthcare institution that doesn't adopt an integrative approach to discomfort management in a multidisciplinary way is derelict in its responsibilities to the patients they care for. That's a fact. Of course, pharmaceutical strategies will forever be part of our multidisciplinary approach. However, cognitive and mental strategies, as well as physical strategies employing supportive essential oils, will likewise include clinically proven modalities such as guided imagery, meditation, Reiki, massage, and not the least of which, aromatherapy, or the clinical application of essential oils. The connection between discomfort and our emotional well-being is fascinating. And this is a core part of self-efficacy I discussed. The fact is, our emotional and mental response to unpleasant sensations can heighten the severity to which we perceive them. When we work to control our emotional response to discomfort, we can reduce it. Isn't that fascinating? For example, promoting a sense of relaxation and calm can dramatically diminish the unwelcome experience of physical discomfort. You can use complementary mental modalities to affect your natural response to various stimuli. We'll never entirely eradicate discomfort from our lives. However, we can take on these kinds of experiences in a multidisciplinary way. We can emphasize and tackle the physical, mental, emotional factors that contribute to the discomfort we all feel as part of the human experience. Although orthopedic surgeons aren't psychologists or psychiatrists, we indeed encounter the psychosocial aspects of human behavior in relation to overall well-being every day of our practices. We do care deeply about the well-being of our patients and will integrate topical, inhaled, or ingested essential oils as a supportive part of our multidisciplinary, FDA-approved, board-endorsed pillars of managing our patients' overall health, well-being, particularly in times of distress. This is what I've done in my own practice. Recognizing the benefits of an integrative and multidisciplinary approach, I've enhanced my practice and therefore my patients' experience by incorporating essential oils. This approach leverages essential oils to assist, support, and maintain a positive emotional response in my patients. I've employed a full-time massage therapist for my office, trained in the aroma touch technique. Prior to consultation in the outpatient clinic setting, as well as the preoperative holding area before their surgical procedure, the patient is given a hand and forearm and foot and calf massage with 2 drops of the following 4 oils commingled in a carrier medium: frankincense, bergamot, lavender, and aroma touch blend. This massage has been remarkably soothing for patients as they are preparing for their surgical consultation or their operation. A Copaiba massage has provided excellent relief and supports the overall well-being of my patients, and a very soothing effect to the upper extremities and hands. Finally, all of my patients are given a Digest Zen soft gel in the post-anesthesia recovery unit, the PACU. The postoperative digestive discomfort so commonly associated with anesthesia can be considerably mitigated by the soothing, supportive effects of the 6 essential oils in this blend, specifically fennel, anise, coriander, caraway, peppermint, and ginger. So, what are the essential oil solutions to resolve this discomfort cycle we've been discussing and provide much needed relief? Early use of topical essential oils can be soothing to the mind and body during the cycle of discomfort, particularly when incorporated as part of a massage to the affected extremities. Some of my favorite essential oils that have been studied clinically, either alone or in combination with other essential oils, include ginger, lavender, peppermint, rosemary, and clary sage, all of which I use in my practice. And don't forget the blends Deep Blue and Aroma Touch. To support a healthy inflammatory response and attack persistent discomfort, I recommend Copaiba soft gels, turmeric dual chamber capsules, and yarrow palm. Taking these supplements provides broad support in the body. These solutions, working in tandem with traditional solutions, enjoy statistically significant efficacy within the context of supported human trials. So here's to the future of essential oils and their soothing, supportive capacities for patients who are struggling with discomfort.
My name is Dr. Kelly Lancaster. I live in Bowie, Texas, and we live on a ranch